Hi, how are you? Do you remember Gertrude Kennedy?
Yes, I do. I'm one of the emergency room nurses. She came in. She's a 65-year-old woman. She came in with complaints of pain in her right leg. She stated that she hit her leg 2 days ago, and she just now noticed that there was some swelling in her leg, in her right leg. She also has a very sedentary lifestyle. She uses a hover round to get around. She normally does not get out of it unless she's going to the bathroom or going to bed at night. She also smokes 2 packs of cigarettes. Let me give you a little bit of her medical history too to go along with this. She was diagnosed with type 2 diabetes when she was 40 years old. She went to her family physician and presented with signs of frequent urination, unusual thirst and hunger, extreme fatigue, irritability, and blurred vision. And she had some cuts and bruises that took a really long time to heal. So they prescribed Actos for it, which is a drug that is used specifically as an anti-diabetic drug, oral drug. Given to the hospital for diabetic nephropathy. She had some numbness, some reduced ability to feel pain and changes in temperature, especially in her feet and her toes. So she was given Lyrica to manage this pain associated with diabetic nephropathy.
Do you know the dose that she was taking?
The dose that she was given initially was 50 milligrams 3 times a day, and then subsequently was moved up to 200 milligrams per day. And then it can be increased to 300 a day within 1 week based on the efficacy and tolerability. And the max to be 100 milligrams per day, or 100 milligrams 3 times a day, which is 300 milligrams per day. She had a fall 5 years ago. She was taken to the hospital and given an x-ray. She was found to have microfractures in her pelvis. So just as a precaution, she was given Boniva, which is for osteoporosis. The dose for that is 2.5 milligrams per day. And that is the end of my report.
Yes, my name is Carlos, and I am the MD who saw Miss Kennedy when she was brought here to the ER. When I saw her, I immediately thought by her presentation that it was a DVT. DVTs happen for 3 reasons, and it's called the virtuous triad. Okay, so let me show you this so you can have a better understanding of what's going on with Miss Kennedy. Here we have a representation of all the blood vessels in the lower extremities. We have veins and we have arteries. We have 2 types of veins. We have superficial veins and also deep veins. Deep veins are located within the muscles of the legs. Contraction of these muscles is what pushes the blood up towards the heart. Also, deep veins have valves. The function of these valves is to prevent backflow of blood towards the feet. DVTs are formed when a clot is formed in a deep vein. Sometimes these clots are big enough to completely occlude the vein, and sometimes they are not that big, so they only partially occlude the vein. Many times though, the clot is small enough so the body can eventually dissolve it. Like I mentioned before, there are a couple reasons why a DVT can be formed. In the case of Miss Kennedy, the DVT was formed due to long periods of immobility. And like we can see here, which is exactly what happened to her, the DVT completely blocked her vein. when you have long periods of immobility, that causes venous stagnation. Venous stagnation will put you at a high risk for DVTs. So the first thing I did after I saw Miss Kennedy was to order a couple of tests. One of them was the ultrasound test, RF testing, D-dimer testing, and coagulation profiles. Like this is the ultrasound to detect DVTs, and what we are looking at here is the pulsating mass on your left. That's the femoral artery, and the blood is coming through that. That's why it's pulsating. On the right side of your screen, we have the femoral vein, and here we can start looking at the formation of the clot. Right here in the center, we can see the mass. Testing. When we look at that, once you see a mass on the vein, we press on the skin to see if the walls of the vein compress. So the vein looks like this. Once the ultrasound is right here and compresses down on the walls, it's supposed to make the walls touch. Once the wall touches, it tells us that there's nothing impeding the walls from being contracted like that. On the other side, if we had a clot and we're trying to collapse this, we wouldn't be able. And this represents perfectly how it looks in the ultrasound, which is what we just looked at. This was the thrombus that was being formed. So once we saw that, she was given a loading dose of 250,000 IUs of streptokinase, which is a thrombolytic agent. This thrombolytic agent converts plasminogen into plasmin, and this dissolves the clot. After that, we started a heparin IV, and I can't remember the dose for heparin, because to give heparin you adjust the dose according to the coagulation results, which I don't have on me at this point. So after we started thrombolytic agent and the anticoagulation therapy on Mrs. Kennedy, we kept her in the hospital for 72 hours, and after that, fortunately, the clot was dissolved, because what could have happened was that clot could have moved up in the body and could have developed pulmonary embolism, which is a very serious situation. Hopefully, luckily, with Miss Kennedy, this did not happen. So after the 72 hours, she was able to go home, and she went back to her medications. She's still taking Actos, Boniva, Lyrica. The only change I made was on Lyrica. Also, once she went home, we continued the coagulation therapy. However, we moved to an oral anticoagulant, which was Coumadin. And now for her diabetes, it's been controlled. However, though, she needs to lose weight. She needs to exercise more, because exercise will actually increase the activity of insulin, so she can use better glucose and control better her diabetes. Also, her diet needs to change, primarily because now she's on an anticoagulant, and she needs to be very careful of her intake of vitamin K, which is a vitamin that's very important for coagulation. If she starts eating a lot of leafy greens like spinach, this is going to counteract the action of Coumadin. Also, we taught her to continuously check her feet throughout the day. Sometimes the neuropathy gets so bad they stop feeling their legs, and some people have stepped on nails and have the nail a whole day there on her feet, and this is a huge risk for infection. So we asked her to continuously check her feet for any abrasions or bruising, and also for Coumadin, one thing that we recommend for her was she needs to be really careful. She needs to try to avoid cutting herself or getting hit by something, because if she starts bleeding internally, because she's on an anticoagulant, she can bleed a lot, and probably that could develop in a big issue. That's all I know from Miss Kennedy. I haven't talked to her since. Actually, I should give her a call, and I think I'm just gonna do that right now.